I got the thumbs up from Bruce, so I think we can get started. Hi, everyone. I am thrilled to welcome you to our 7th annual Professionalism Week here at the Larner College of Medicine. Thank you for being here. I know we have many people also online. This is midweek of Professionalism Week, where we're getting together to listen to a visiting speaker, have community, and learn more about how we can be better in what we do and frankly enjoy each other's company. So I'm glad we're able to feed you as well. Last evening, we had an amazing night as we discussed the beautiful piece entitled Willow Tree, which is a mosaic by Mary Lacey that's going to be hung out in the Gibbon lobby, we hope within the next week or so, in honor of the anatomical gift donors to our college over the last 200 years. Today is a highlight of our week, and today we get to welcome Dr. Richard Schwartzstein, who's going to speak on a very timely topic, especially in today's environment: professionalism during tumultuous times. Dr. Schwartzstein is the Ellen and Melvin Gordon Distinguished Professor of Medicine and Medical Education at Harvard Medical School, that little shop down the road in Boston. And he is Chief Emeritus of the Division of Pulmonary and Critical Care Medicine at the Beth Israel Deaconess Medical Center. He's a graduate of Princeton and Harvard Medical School and has been an active clinician educator as well as physician scientist with expertise in respiratory physiology and educational research for more than 30 years, a really interesting combination of research specialties. Early in his career, Dr. Schwartzstein advanced our understanding of dyspnea by linking patients' descriptions of their breathing discomfort with the underlying physiology of respiratory disease. He later served as executive director of the Shapiro Institute for Education and Research at Harvard Medical School and the Beth Israel Deaconess Medical Center, as well as vice president for education at the Beth Israel Deaconess Department of Medicine, I believe. He's an award-winning educator, the author of Respiratory Physiology, a Clinical Approach, and he and I just had a chance of discussing the importance of the physical exam, including percussion of the lungs, as well as auscultation. I've got to say, I still percuss before I listen. He's been the recipient of a number of national teaching honors. His current research focuses on clinical reasoning, small group teaching, simulation, and the limitations of artificial intelligence in clinical problem solving. We also have a meaningful connection with Dr. Schwartzstein in that several of our colleagues, Dr. Karen George, Dr. Katie Huggett, Dr. Yuqin Zhao, and Dr. Natalie Feldman are all collaborating with him and his team, along with researchers from WashU and St. Louis, on a multi-institutional study exploring how different generations define and understand medical professionalism. I suspect we'll learn more about that today. It's really a privilege to now welcome him for our keynote address. Please join me in welcoming Dr. Richard Schwartzstein.
A pleasure to be here today, and thank you for that very kind introduction. You guys have, I'm not aware of any other school that has a week dedicated to professionalism, and it's very special, and it says a whole lot about your school, about your faculty, your educators. It's it's just fantastic, and I'm really impressed by it. I've been talking a lot about this, and we've had a big national conference in, we were trying to remember the year it was now, but it was 2023. And I want to first give some thanks to the wonderful team that came and represented University of Vermont at the conference. So the Shapiro Institute runs these national conferences every 2 years. And we've been doing it like that since I became the director about 20 years ago. And it's on some topic that's a big topic in medical education. And we usually get 20, 25 schools that want to come, that submit applications. And we typically pick 7 plus a team from Harvard. And the team from University of Vermont represented here was really one of the most significant teams in that conference and has done more since then than I think any of the other schools that came to that conference. And I just really want to point that out as a really accolade for the nature of this school, the ability to take something and really to make it into a concrete program. And this notion of a week dedicated to discussing and thinking about professionalism is just absolutely wonderful. So I have these goals today, and not quite learning objectives, which educators are always big on, but some insights over the decades that I've spent in medical education thinking about professionalism. Some of the challenges with professional identity formation, we talked a little bit about this at lunch today with some of your lead educators. It's a big term since 2010 when it was really first coined, and it came up in the conference we ran with some challenges. We're going to talk a little bit about that and how we might otherwise deal with it in the way you guys, I think, are dealing with it. This construct of professional values integration. And you talk about this, values is a term that you use all the time. And again, of all the schools I think that were at the conference, you have embodied this more than any. And I'm trying to get this going at Harvard and having more trouble than you guys have had here at Vermont, which is wonderful to see. And really challenging us all to think about professionalism in this new era. I mean, the world has changed a lot, and we talk about COVID and we talk about social media and we talk about the politics that are out there, and it's all been very challenging. And you say, well, it doesn't have much to do with medicine, but it does. I mean, it does because we're not separate from the culture and everything going on. And so it affects our patients and it affects us as teachers as well. And I want to make this kind of interactive, and so I'll wander a little bit, which may be trouble for the people on Zoom, but I apologize for that. But what is a profession? Now, here's a sort of dictionary type definition: a specialized skilled occupation. All right, well, medicine fits that. Advanced academic training, formal qualifications, a strict code of ethics, expert knowledge, self-regulation. Now, what does that really mean, right? In terms of our responsibility, thinking about ourselves and our training. And yes, we have to get recertified every 10 years if you're a specialist, but what do you do in between those exams and so forth, that kind of thing. Commitment to public service rather than just personal gain. Not usually the way people think about professions, but it's out there, and I think it's important. Values again, keep coming back to values. And I like to do this. Think about your last encounter with a new patient. What kind of questions did you ask? This is for the faculty. What kinds of questions did you ask? Pretty personal. What do you mean? Give me an example. When's the last time you pooped? All right. What other kinds of personal questions? What other kinds of things?
Do you smoke?
Do you smoke? How much? It's good. Okay, what else?
How do you get around at home? How do you take care of yourself? Do you need extra help?
Good, all great things. There's a big one that's still out there. Important people, yeah. Do you feel safe? How much do you sleep?
What's important to you?
What's important to you? How can I help you? Do you drink? Do you use drugs? Sexual history? Can I walk up to somebody on the street and ask them those questions? If your plumber came in and asked you those questions, would you be put off by it? This is a special privilege that we have been given as doctors. And then there's a physical exam. Imagine walking up to somebody in the store and starting to do a physical exam on them, right, or something, you know. No, I mean, you know, that we a battery, you know, that's a legal term for it. You're putting your hands on somebody else's body, it's battery. Does the public have a right to expect a little more from us? Yeah, I think they do. But we don't think of it that way sometimes, right? The questions we ask, the answers we seek, the things we do as part of a physical exam, these are things you cannot do if you are not a physician. So yes, the public expects a little bit more from us in a series of ways that we talk about as professionalism. But I want to start out with that context because it doesn't get talked about very much. Even we have a practice of medicine course we call where you learn about doing history and physical exam. I don't think they talk about that, you know, in that course. But that's the beginning of thinking about why this is important to think about standards and professionalism. What does that mean? So if you think about, you know, word clouds, you know, they take, what's one word that you think? So what word pops into your head for professionalism? Anyone?
Trust.
Trust. Accountability. Integrity. I'm sorry? Good. Kindness. Good. Authority. Respect. Oh, do we have any students here? Traditional. Okay. So here is a word cloud. This is from 2017, so it's a little bit older. Patient was the one for this group that was the biggest answer. Honesty, compassion. I mean, there's lots of words there, and some of them that we haven't talked about didn't come up here, but those are big ones. Up to date. Up to date, keeping yourself knowledgeable, current, the latest things that are going on, important. Listen, ethical. All right, so I'm sure these words will resonate with you as well, and there's lots of words that are used. And things perhaps that we would add in 2026 that are different. Why does this matter? So this is an old paper, but it was powerful. About what happens for people who have unprofessional behavior in medical school. Well, they wind up in front of their state boards more often. So when we as faculty talk about this and teach it, and for the students who say, well, you know, you're using professionalism as a bludgeon. You only bring it up when we do something wrong. That's what our students tell us all the time. That's one of the problems they have with it. We don't talk about it in a positive way. Those words we had on that word cloud, and the words you guys use, those were all positive words. But we tend to bring professionalism out when somebody goes over the line, doesn't act accordingly to what we expect. But it turns out that you wind up having problems later. Use of drugs or alcohol, unprofessional conduct, negligence, sexual misconduct. You say, what does that got to do with professionalism the way we teach about it? Well, you know, again, that's the special responsibilities we have. And if we go over the line in certain other ways, we're more likely to have problems later on. So it isn't just we talk about it because it's a nice thing and that's what we've always been doing. It's because it actually translates into behaviors later on. If you're struggling with this as a student, you're likely to struggle with this as a practitioner. At least that's what the data tell us. And it's a reason for emphasizing it and talking about it. Which gets into this issue of what does it take to make a great doctor? Again, we talked a little bit, you know, at lunch today that I teach a first-year course, required course on respiratory, cardiovascular physiology, pathophys, anatomy. It's a systems-based course. And I tell the students on the first day of the course, I have two responsibilities. One to them as a student to make them the best doctor I can, and the other is to society. That I'm going to turn out people with these special responsibilities we kind of were talking about who's going to be really well trained. And I take both of those seriously. And if I think you're not going to be the kind of doctor I want for society, that's a problem. And I'm going to bring it up. So I have a bigger picture than just the usual teacher-student interaction. We have a responsibility to society that's very different than I think most other professions. And it's why we really take this seriously. What makes a great doctor? Again, from something the Harvard School of Public Health did, you can look at the list of phrases there. I'm sure these are the kinds of things that you would probably put on there as well. Empathic is certainly right up there. Humble. I have to say, one of the things in this contentious time in which we live is that, and I'm talking about university professors, and we're all university professors at certain levels, but the lack of intellectual humility is one of the things that I have found to be a real problem at Harvard University, frankly, right now. And we have to think about that. We don't always have the right answer. We don't always have the right perspective on a problem. And do we have the ability to say that? This is what I think, but I'm open to another idea. You know, let's engage in a respectful conversation. You know, and how do we model this? We're going to talk a little bit more about modeling as we go on. But, you know, in this, you look at these words, there's not a lot about, you know, does a good physical exam or does, you know, I mean, those aren't the kind of things that people are talking about. What makes a great doctor? Although I definitely think they're important, including physical exam. But these are the human aspects, because ultimately our interaction with our patients is a human interaction. And so those qualities, you know, are really important. And these qualities then link to these attributes that we talk about as professionalism. All right, so there's a lot of talking about the old days and the old faculty and what are they, you know. So here's the really good old days, right? 400 BCE. I like to say rounds were really fast in the hospital back then. Pharmacology is driving me crazy right now. I can't keep up with the drugs. They didn't have, Hippocrates did not have to worry about pharmacology particularly. The Epic, oh my God. You guys use Epic up here? I actually wrote to my congressman. I want him to start antitrust regulations because they now control 60% of the academic market, and you can't get them to change because they don't have any competition, right? So, you know, but Hippocrates didn't have to deal with that. Yeah, they had occasional wars between Athens and Sparta, you know, but we have Iran and, you know, we've got our own, you know, kind of problems. And I pretty much bet they criticized the younger generation. So, but, you know, those were the good old days, right? And we kind of learned from that as well. And then the pandemics. Now, most of the talk is about COVID. These two pandemics kind of framed my career. The HIV epidemic was, I was a house officer, and people, I don't know if there's anybody old enough now, otherwise in this room to remember this, but people were really freaked out. You think they were freaked out during COVID? HIV was really scary stuff, you know, because they died. We didn't have any treatment, and the death rate was higher than it was for COVID. And people in the hospital were really afraid. And we weren't sure about how it was really transmitted and all those things in the early years. And it was very, very scary. And then, of course, there was COVID. And again, people were like, we have to have scrubs. They forced our hospital to provide scrubs for everybody because I didn't want to take my clothes home because it might be on the clothes. It might infect my kids. I'd be able to, you know, come in, change into your scrubs, leave those scrubs, go home, you know, on, and all these things that were going on. And people were really scared. And we were doing, there were some people who would do consultations, you know, like a kidney or renal or cardiovascular or pulmonary consultations from the hallway, looking in at the patient, you know, and getting the history and whatever, and not going in the room. I'm like, you got to be crazy. You keep doing consult from the hallway? You know, I mean, people were freaked out. I'm sure many of you were aware of it and similar stories, you know, to tell. But in the end, we had to come back, at least the way I dealt with it and work with it. And my wife's a nurse, my daughter's a nurse. And we were meeting at the end of every day, kind of comparing notes during the COVID epidemic. I'm still a healthcare professional. I am taking care of this patient. And yes, I may be putting myself, yes, I'm wearing all the protective equipment. I'm not saying I was cavalier about any of that, but I still have a responsibility to my patients. And in that sense, that first big word that was on that word cloud about professionalism, remember the patient. This is about our responsibility to the patient is number one in terms of professionalism. And yes, we sometimes have to put ourselves at risk. Not often, but occasionally, it's going to come up, and there'll probably be something else 20 years from now, and that, those of you, maybe haven't had these experiences, that'll come up. It's still about the patient and doing the best we can. Yes, taking precautions for yourself and your family, but it's still about the patient if you're going to be a healthcare professional. And this is, again, what people were talking about. Bronchoscopies. I became a pulmonary fellow, and there was HIV wasn't as bad as those first early years, still there. It's like, I don't do a bronchoscopy. Am I going to get infected from that? Kaposi sarcoma in the airways, we'd see that, and what is that going to be, and how am I going to deal with that? And here I am, as close as you can be to a patient, putting a bronchoscope down, and then the extra hours. I mean, I was division chief during COVID. There was like 5-6 months that went by. I didn't have a day off. I mean, I wasn't in the hospital every day, but I was on the phone and I was dealing with various things. I didn't sign up for this. Well, what does that mean? You sign up, you're a doctor. You did sign up for this. You signed up for whatever was going to happen. Again, I can't predict what's going to be 20 years from now. That's going to be a challenge. But this is what it is. This is what you have to be. People were being redeployed, right? I'm a OBGYN resident. Well, but I'm going to be put in the ICU. We went from 75 ICU beds in our hospital to 135 during the peak of COVID. Well, how do we staff that? Well, we had to bring residents from other services, to help in these ICUs. So, people were standing up. As a little side note, one of the proudest moments I've ever had as a teacher was I get an email from an OBGYN resident at Hopkins who had been at Harvard Med School as a student saying, they gave us a crash training course to go to work in the ICU. It was fine. I remembered everything from the physiology course I took with you, so I was okay. That was like the best feedback I've ever had as a teacher. But they don't always realize at the time. It's really important, regardless, right, of what specialty you're going into. So again, panic. One other thing about COVID that just because all you guys are educators, that I thought was great, for me at least as an ICU doctor, I'm in the ICU and I don't know anything about this disease either, right? And we're all learning together. The faculty, the fellows, the residents, I think the students had gotten sent home at that point, but this notion of, again, intellectual humility, I'm not sure. I'm going to extrapolate a little bit from what we do know about related diseases, but we're all learning together. And again, and that's a great modeling thing, right? Because you're going to continue to learn throughout your life. That's another part of professionalism, that commitment that we make. All right, so then we have the social and political things we're dealing with. I'm just listed here on the side, things that are familiar to you, and of course, health disparities has been, continues to be an issue for us as a society. What is our role professionally as we look at these kinds of things, and given our special position in society as physicians, how do we deal with all of that is another part of how we think about it. And then the generational differences. And, I don't point it out too often, but, when I was a House officer, there were generational differences there too. I mean, it's not a new thing. We seem to talk about it a lot more now and focus on it a lot more. And we'll get a little bit to that because of some of the things that are associated with cell phones and related technologies. But we've always had a little bit of tension, I think, between generations. I think that's just the nature of societies, that we have that. So it's being played out a little bit more in the open right now for a variety of reasons, but that was always there, and we're always evolving, in terms of how we think about our roles and our jobs and our responsibilities as well. So I'm going to turn now a little bit to this conference we ran in 2023 on professionalism. Evolving concepts of professionalism in a world with pandemics and social and political upheaval. And again, we had teams from 8 schools, and UVM was one of the schools there, and they were great. So this notion of professional identity, And these are some of the things that overlapping areas that people talk about. Our personal values, attitudes, morals, and beliefs. And then we somehow have to integrate, the professional aspects of this into all of that as I develop a new identity or a changed identity. And then the medical knowledge and skills and policies and how these all sort of come together. And this, I think the term was originally coined or certainly became big in medicine in 2010 when a book came out on the 100th anniversary of the Flexner Report. And Molly Cook and David Irby were the authors of this book, and they kind of did a little bit of a mock Flexner Report, a little bit thinking about medicine, and they talked about a lot about this notion of professional identity formation that occurs as you transition over the course of 4 years in medical school, and then of course into postgraduate training as well. You continue to refine this sense of what does it mean to me to be a doctor, as a professional identity. And at this conference, I'm going to talk a bit more about it, we found there were some challenges a little bit with this notion. And interestingly, it came from one of the schools that's a historically black university college, HBUC, from Meharry in Atlanta. So we started out with this notion that, professionalism is about professional identity formation. And the word's even there, right? So it makes sense that this is how we evolve and we grow and we change as we go from a college graduate ultimately to a doctor after 4 years of medical school. And so it seemed like these things were just very much intertwined, and it seemed like a good starting point to talk about it. But this is part of the issue that began to come up. And so just to give you a sense of the way this conference is organized and how it happens. So we have the 5 or 6 members from each school on the teams, and we have 3 breakout sessions where teams are split up and you go and meet with other people from other schools, and there are questions that are predetermined. Some of them are based on questions submitted by the schools during the application process, some that we came up with in the Shapiro Institute. And we would discuss these for a couple of hours. And then we'd congregate as a group of the whole in a room like this at Babson College that we use as a site for the meetings. And we would have a discussion. And every group would do a very brief presentation, and then the whole group would talk about the things that came out of the small group discussions. And we do this for a series of 3 sessions on different aspects of professionalism. And then I have this wonderful task as the director of the Institute. The evening after the 3rd session, I have to go write a paper, basically a conference report that summarizes the key things that come out of these 3 sessions. So somewhere around 2 o'clock in the morning of the 4th day of this whole thing, I'm writing this, and it sort of comes to me, there may be some problems with this notion of professional identity. And what we're really talking about, I'm reflecting on all of the things that came up in these small group discussions and reported out in thing, is really about values. What are the values that I have initially as a person interested in medicine? What do I bring to them? And then what are the new values that I learn about and that I have to embrace, as a physician? And when I make a decision, like it's 5 o'clock and I'd really like to go home, but my patient is doing X, Y, or Z, and the person who's coming on call has got some other thing, do I stay? Do I go home? Do I, it ultimately is kind of looking at how these values, how they work, how they come together as a better way maybe of talking about it. Because if it's identity, and I criticize Natalie's decision, oh my God, you're criticizing who I am as a person, my identity. I mean, that's really, but we have a range of values. Can we rethink the value a little bit about how you're comparing, your value to your family or yourself, or value to the patient here? How do we think about navigating that? They're going to be in conflict at times. That happens. But your identity, do I really want to attack your identity as a person, as a doctor? It seems so much more threatening to me. And so it's 2 o'clock in the morning, who knows what else was going on in my head at the point, but we sort of came up with this notion, instead of professional identity formation, professional values integration. And this notion of intersectionality, which has been around for a while now. I mean, we're all these things, right? This is what makes up our identity, all of these things. And it's part why it can be dangerous to attack somebody's identity or be perceived as attacking somebody's identity by challenging some action that they took. If I define the action as coming from their professional identity. And so this was a challenge for us in many ways as we went through the final days of the meeting, final day of the meeting. But ultimately it came back that we really wanted to do this notion of values and how we think about these integrating. And the interesting is when I first mentioned this in the conference, so I had written this paper the night before we distributed it, the first thing in the morning, teams were in their own meetings as school teams, and they come back for a discussion about the draft of the paper. And I started to talk about this idea that I had of professional values integration instead of professional identity, why I thought there were some problems with it. And the team from Meharry was like, you are so right. And they said for them, the notion of professional identity was a real challenge. You know, as a school with minority students and faculty and so forth as a predominant element of their school, they really embraced this, which was surprising to me in some ways, but it was very powerful at the time. And so we came up with this notion of values and integrating values. And I know, again, you guys have done more than, as I said, any of the other teams that were at the meeting about really doing something with this in your school and your curriculum. And this notion of dedicating a week, and you're wearing, you know, I've seen some of the badges and things about values, I think is really wonderful. And this notion about, again, how do we think about my values as a father for me, as a parent, as a brother, as a son when my parents were alive, as a, you know, all of this, and as a doctor. And somehow I have to weave these together. And it changes, you know, from whatever the context is and what's ever happening at the moment. So we have to think about that very much. And this gets again into values, links up with these sorts of things which are not going to be new to you: integrity, honesty, respect, and ethics, some of which came up on that initial word cloud as well. You know, I love the notion, the definition of integrity. It's what you do when nobody's looking. You come to a stoplight at 2 in the morning, do you stop? Nobody around? That's what the law is. Do I stop there? You know, I said to students a couple of years ago, we were having a discussion about professionalism in the physiology course, and I said, you know, if I ask you on rounds, and these are first-year students, so they haven't really been in the clinical environment, but if I ask you on rounds what the serum potassium was for this patient of ours, you know, reviewing the labs, and, you know, for whatever reason, you didn't check the labs this morning when you came in, and you're like, good chance it was normal. So I'm going to make up a number, you know, and if you do that, you can't be on my team. You can't be on my team. I can't trust you. You have to say, I'm sorry, I didn't have a chance to look it up, you know, this morning. I don't know what it is. But so integrity really matters to us, even on little, you know, seemingly little things like that. Honesty. You know, your words do matter. Honesty is truthfulness, hugely important. Respect, and I think this is becoming a bigger and bigger issue as our teams become greater and greater. And the notion of interprofessional teams, certainly not new now, but it's becoming really huge. And in the hospital, I know in the ICU, I have a pharmacist in addition to a respiratory therapist, in addition to the nurses, we may have a physical therapist, nutritionist. They're all members of the team. And I can count on them. God, I don't know what I would do without my pharmacist anymore. You know, relatively new about the last 5 years or so, but it's huge, right? And I have to be respectful, of course, to them, and always am. And the nurses, and, you know, tell me what your impression is today. And you saw the family yesterday. We didn't, because they were in and out, and you saw them and met with them. Tell me about it. You have a value to add to the team and to the care of this patient, right? So this notion of respect is huge, I think, now for teams. And we try, in our school, we do a lot of teaching in the pre-clerkship curriculum with students sitting at tables of 4, and we have mandatory attendance. And a lot of when I tell this and talk to people from other schools about it, they go, oh my God, how can you have mandatory attendance? And we say, look, this is about your team. And you learn together as a team. And it's the best model I can think of in a pre-clerkship curriculum for teamwork. You may know everything. You may have just done the prep work and you are solid, you don't need to come to class today. But your teammates need to come. And if you know all this stuff, you teach them. You're going to help them. And someday when you need the help, they're going to be there to teach you in the small group. So this is about teamwork. So that's why attendance is mandatory. And you can't not show up for your rounds because you're okay with, you know what you have to do on your patients, right? You got to be there for the entire team. Ethics, again, some of the major elements of ethics probably known to all of you also, of course, are part of this. Respecting patient choices. This has become an issue in some ways for us, as the notion of moral injury has become a bigger thing, for doctors these days. And again, this notion, do I put my sense, and so what am I talking about? I should maybe be a little more concrete. So during COVID, for example, we had a patient in the ICU who was going to die. I mean, it was clear she was on a ventilator, not doing well at all. She was going to die. And it was in renal failure, and the nephrologist decided we're not going to dialyze her, so she was going to die at some point from that, if nothing else. And everybody wanted to make her, and the team wanted to make her do not resuscitate. And the family didn't want to do that, at this juncture. And, we had people talking about, well, I have this sense of moral injury taking care of this patient, which to me was a little bit about putting my thoughts, in front of the patient. Again, patient was sort of foremost here, patient's family, through them. And that I felt we had to really do this. Now we had a nurse who needed to come off the case. We found another nurse who could take care of the patient. We tried to respect their feelings, but this notion, of really placing the patient autonomy and respecting their choices, at the forefront. To me, as somebody who works in the ICU and deals with life and death issues on a pretty regular basis with families, has become a big thing for me, with a lot of discussion among our faculty and our teams. And again, the value of teams here, and this is another word cloud in terms of the things that people think about with teams, but trustworthiness, really important, right? You don't trust the other members of the team, it's a real problem. Reliability, I got to be able to count on you. You got to be there. And there's sometimes, you just have to show up. And again, there may be a reason you can't, but it's got to be an important one, and it's got to be one that you then take steps to make sure that whatever responsibilities you had are going to be able to be picked up by others on the team if you can't be there. This is a book that, as we get into some of the issues around generations, that I think is really important. If you haven't read it, I highly recommend it. The Anxious Generation by Jonathan Haidt. It's a few years old now. Just show of hands. Has anybody read this book? A few hands go up. Jonathan Haidt is a social psychologist at NYU, a professor, and it's really good research, that he's done. And he attributes the mental health issues that we all hear about with Gen Z, to use the typical term now. He attributes to two things. One is a change in parenting styles in the early 2000s, where parents became incredibly protective of their kids, afraid about somebody getting picked up on the street or whatever and kidnapped, or, had to be with their kids all the time. And the kids didn't develop the ability to just interact with their friends, get into fights, resolve them, take all the things that are typical of childhood didn't happen for many people in Gen Z. And it was a problem for them. And then the second thing was social media, which I think is probably going to be the be-all and end of society, civilization, because particularly with AI, we can't trust anything that's on social media, and people have not been taught in our universities, unfortunately, to think about where's the information coming from. Is it valid source? Do you know how to assess sources? All of that stuff, which I feel like I was taught in college, but is not really being taught the same way anymore right now in college. So between social media and the comparisons, my friend Sally's having all this fun and I'm not, there's something wrong with me, it's, all that kind of stuff. And of course, Sally's lying about how great her life is, but I don't know that. So I'm going to be depressed because of all that. And so he goes through this. And of course, what came out of this was this notion of wellness and spiritual, social, emotional, intellectual, physical, and all of our students are talking about this, our residents are talking about this. Do you guys have unions yet for your GME people? Yeah, so big thing for our union. Our union was formed about a year and a half ago. A huge discussion point is wellness. But we have to understand where it's coming from. And it's not coming from overwork. I mean, there's been a big reduction in duty hours in the last 20 years. And if you believe it's overwork, there's a problem, because the duty hours was like 100 hours a week when I was an intern. Now it's 55 or something for internal medicine for most places. And the mental health problems are much worse. So there's sort of a disconnect there if we're saying that working too much is the cause of all the evil, when we've done a lot to reduce duty hours and the mental health stuff is worse. And I've been talking a lot more about this concept of well-being. Another great book. It's a little older. I think it was published in 2011. Martin Seligman was I think he's retired now, a psychology professor at the University of Pennsylvania. And he was one of the inventors, if you will, of positive psychology. And so he didn't talk about wellness because the term wasn't popular back in 2011, but he talked about happiness, which is akin to wellness in the way most people use the term. And he said, happiness is great, but it's kind of transient. I mean, you can be happy one minute and then something happens to you, man, you are not happy anymore, right? So it comes and goes quickly. But well-being is different. Well-being is about meaning and purpose and accomplishment in your life. And if you have a sense of well-being, you can have a bad day. It's just a bad day. It doesn't disrupt your sense of well-being. I often tell people that as an ICU doctor, if I can, I'm walking home at the end of the night and I'm thinking about my day, if I could make one of those patients smile, as sick as they are, it was a good day. It's a good day. Relieve their suffering. I often say, if you want to get the ethos of medicine, regardless of your specialty, it's relieving suffering, human suffering, right? And so if you can do that, you're doing okay. And I tell my interns in an orientation session that I do with the interns when they come in, no, this is not going to be the worst year of your life, because that's what everybody's telling them, right? Oh God, internship, we're telling you it's horrible. No, this is going to be the best year of your life. You are going to learn so much. You're coming in, you can't do anything for the patient, practically, right? You're going to finish up and wow, you can do it. And I often talk about, I remember the night I became a doctor during my internship. Well, about 60% through the year. At 2 a.m., I had an admission, a transfer from the neuroservice, who got admitted with altered mental status, turned out to have DKA and had a lot of metabolic problems, and that was the problem. So I get to go to see this patient, and they're lying in a pool of urine, and I'm putting in a Foley catheter and helping the nurse clean him up and putting in IVs and calculating his insulin dose. And back in those days, I actually had to wheel him in the middle of the night to radiology to make sure he didn't have pneumonia and all that stuff. And after 2 hours, I called my resident. I'm ready to present the case. And it was like, that's it, I can do this. I'm a doctor now. But talk about well-being, right? Nothing about my going home or doing yoga or going out for a run or, this is very different, sensation that's incredibly important. And that's what you're going to do as an intern if you, approach it the right way and get that sense of well-being. And that's what we should be talking about. This is what we need to encourage. And we need to not play into this as terrible, terrible, terrible. No, this is a great experience. And we have to show that enthusiasm as attendings, as faculty. And we have to talk about the excitement of learning and becoming competent, as a physician and being able to relieve suffering. So again, distinguishing wellness and well-being. And this is the union's always pushing for all this stuff on the left, and I keep talking about all this stuff on the right. Making a difference, helping your colleagues, your team, filling in for somebody because they have an emergency at home. That's actually important stuff. That's, a community, really important relationships. Family meetings for me in the ICU, if I can make death easier, that's huge. Can't do anything anymore for your parent, but I can help you guys as children get through this terrible experience. That's a really meaningful thing for me to be able to do. That contributes to my sense of well-being, even if it took an extra hour for that family meeting, at the end of the day. So context, this was another big thing that came up in our conference and comes up a lot, I think, for our trainees and our students, right? Somebody's late for rounds because they watched the Super Bowl till 2 a.m. and drank too much, and that's not a good thing, right? But they came in late for rounds because there was an accident on the way into work, and they stopped and they took care of somebody at the roadside, and now they're late. Context matters. Being late for rounds, but context matters. And I think we as faculty do not search for, are not curious about the context. We just assume, Sally was unprofessional, came in late. And that shouldn't be our approach. Our approach should be, you didn't do this thing the way you should have, I thought. Why? What else is going on in your life? What else is happening? What's the problem that you're dealing with outside of the hospital as well as potentially inside the hospital that I need to know about, or the classroom? I had a student a few years ago, in the first 2-3 weeks of the class, she was knocking it out of the park. And then suddenly something changed. She didn't seem prepared, couldn't answer questions in class. And I sat down with her and said, what's going on? Tell me what's happening, because something, day and night kind of thing. Well, she was on scholarship, we were, getting aid from the school, and something changed and they took away her aid and she went on food stamp. I mean, it was a really horrible sort of story. Yeah, this wasn't unprofessional behavior. This was somebody who was going through a personal crisis. And I sought out the context, which, we don't always do. And I, have to do what I call mental face slap, if I start to jump to conclusions without first checking to see what the context is. But that's really important when we talk about professionalism, because I understand and appreciate when students say you use it like a sledgehammer, right? You only talk about it when there's something bad happening and you assume the worst about me. And so we can't do that. So again, there are tensions here. And even when we talk about my values, personal versus professional, family versus team, moral injury. I mean, these are tricky things. And we all have to, make these determinations, if not on a daily basis, probably weekly or certainly monthly. You're going to have these kinds of conflicts. And I think it's part of our job when we talk and think about professionalism to help our students think through their values and these external values, if you will, that they're beginning to internalize in some ways, or at least integrate with their own personal values. And how do I make that happen in a way that preserves your values as much as we can, but makes it work with what this new responsibility and privilege that you have been given, starting out with those, what are the questions I ask and what do I do during my physical exam? That is a privilege. And it comes with responsibilities. And we have to acknowledge that, as we talk about, professionalism. So ultimately, part of what we did in the conferences, or before the conference, we did a Delphi on professionalism, and these are some of the themes: act with integrity, demonstrate respect, strive for competence and clinical excellence, and be accountable were sort of the major themes. Again, not surprising, but this came out of a Delphi study with leading educators around the country. So those core values, if you will, I think are evident to most people. And I think talking about them, again, your internal values, how do I make these integrate and resonate well, is really important. So, for the students maybe out on the Zoom, I think my advice is to be thoughtful in who you're becoming. And it's this sense of becoming. It doesn't happen overnight. And that night that I remember becoming a doctor, it felt like, no, but that was the response to a long line, 4 years of med school and 6 months as an intern before it was like, yes, I can do this. And I think I worry, frankly, another part of what I worry about, it's a system. It's not a worry about, anything that students do or residents do, is that we have increased our supervision so much, particularly at the GME level. I mean, we have 24/7 coverage of our ICUs with attendings. That wasn't true when I was a house officer. At night, I mean, somebody was available by phone. You could call them and ask for questions and ask for help, but you were it. You know, and there's something different about, I have to make this decision. There isn't anybody else here right now. And being able to do that with a little bit of remote supervision, I think was useful, and we have gotten rid of that. The system has gotten rid of that for the most part. And I think we've lost something there. And people graduate without ever having had to make a decision on their own. You know, it's not a great thing. So that's an issue for us. And then strive for well-being, I think. And that concept is new for most students and residents in my experience, but I think it's important. And for us as faculty, again, professionalism is not a four-letter word. It's not a thing to use as a sledgehammer. And we are role models, whether we like it or not. And one of the big problems we have, and I chair the Learning Environment Committee at the medical school, and we get the feedback from students after every clinical rotation. You know, they badmouth other specialties. And I'm sure you've seen it, you know, often among the residents, right? You know, the surgical resident gets a consult from the medicine team. I can't believe that they can't do that on their own. They need to consult us for that, you know, because everybody feels overworked and it's one more, you know, consult I have to do. Well, the students standing there and going, you know, this is how they talk about other specialties, and sometimes it's the faculty, right? We've got to be mindful, you know, of those kinds. Seems like little stuff, but that's like really important stuff. And again, relationships, and they're complicated. Friends, family, colleagues, local and national, you know, all of those things. They're complicated, but they're important in a sense of community. And we also need to strive for our own personal well-being. So I will stop there, and I don't know see what time it is here. Take some questions, yeah. And feel free to disagree and state that, and that's great too. If there's something I said that rubbed you the wrong way, but other thoughts that you have.
We have two questions on Zoom.
Okay.
One says, thank you for your thoughtful lecture. Regarding the distinction between wellness and well-being, I'm wondering whether there has been any discussion about the impact of the well-being of attendings and medical educators on incoming medical students and trainees. Many attendings and educators appear to have been profoundly affected by the COVID-19 pandemic, which at times seems to contribute to inattention or diminished engagement in both preclinical and clinical learning environments.
Yeah, it's a great point. Our faculty, the burnout, you know, issue is out there all over the place in public media, as well as the medical journals. And I think it's because people have lost this sense of well-being. And there's this notion about practicing gratitude. You know, it's another thing. My philosophy is I don't want to ever go home angry, you know, or unhappy. You know, so I make a real intentional choice as I'm packing up and getting ready to leave at the end of the day. What good things happened today? What went well? What was a good interaction? Yeah, Epic drive me friggin' crazy. I'm sorry. You know, I think it is the worst thing. But, you know, no, I'm not going to let that, you know, dictate. There's a saying, I don't know where it came from originally, but you can't control what happens to you. You can control your response to it. You know, so yeah, that was a bad thing, but I don't have to be unhappy about it or angry about it or whatever. I can control that. So it requires an intentionality on our part to say, I'm not going to let Epic make me crazy, or, you know, that consultant make me crazy, or whatever it is. It was a good day. There was this good thing that happened today. And I'm going to hold that and practice gratitude for that, a good interaction with a colleague, whatever it might be, you know, and I'm going to focus on that. So yes, we as faculty need to do this too. You know, there is burnout. I'm not going to deny that it's out there. But again, I think it's all about the externalities. Yeah, Epic is doing this is doing that. They want more, you know, I have to see patients too frequently. All that, you know, all that stuff's going on. I get it. But we can control our response to that, and we can still figure out a way to find positivity in all of that, and that's what we need to do. Another question on the line, or?
I really appreciate the talk, especially coming in with values, and especially as a learner, so I'm an M1. One of the things that comes up in thinking about professionalism is the difference in values that folks having, if that's kind of where we're going. So how do you, especially as you're just kind of steeped in this environment of determining what professionalism is, how do you reconcile those the value differences that you might have, whether it's across generations or just between human beings?
Yeah, it's a great question. I'm not going to pretend I have, the perfect answer for it, because I don't know that there is one, and you may have your own. I try to listen well as I can and inquire. For me, I've been asked occasionally if I had one trait to find in a medical student or a potential medical student in admissions, who would you look for, or what trait would it be? And I'd say it's curiosity, because I think curiosity is the key to lifelong learning. It's also the key to humanism. I'm curious about you as a person. I'm curious about your family. That's humanism, right? It's about curiosity. It stems from that. And it's also about your team. I've got to be curious about that. So if you're having a bad day, why? Let me find out more about, what's happening. I mean, it sounds like we never do things on, never ever sacrifice our patients here in my generation for something else. Well, it's vivid memory when I was a pulmonary fellow and I'm in my clinic, and my son, who was 3 years old at the time, my oldest son, had a respiratory infection, and he was crying that morning, and he broke out in petechiae. And I said to my wife, take him to the doctor, tell the doctor I'm going to be an annoying doctor parent, but I want a CBC on him, because I was afraid, this might be leukemia, and he's got no platelets or something, and he's got petechiae just from, crying. So anyway, I go off and, to work, and I'm in my clinic seeing 2 patients out of 6 or 7, whatever I had on the schedule that day. And I get a phone call from my wife, and she is sobbing because he had a CBC and all of his counts were low. There were no tumor cells, but all the counts were low, and they wanted to do a bone marrow aspirate the next day. And she could barely talk to me on the phone. And I said to our staff person, you need to apologize profusely to everybody else on my schedule. I need to go home. My wife's melting down, and I need to go home. So yeah, personal things do happen where you have to, but it's an ambulatory clinic. There was nobody about to die. There was, issues. I would promise them I would fit them in, sooner, than later. I'd overschedule my clinic, whatever necessary. I needed to go home. Now, it wasn't, he fell off his bike and skinned his knee. I wouldn't do that, wouldn't go home for that. But, this was a family crisis. And the story was he had ITP, and it was all good and well. But, yeah, those things even came up, decades ago, and people left work to take care of a real family emergency. But sometimes, I need to find out why you feel like you need to leave at 5:01, when we still have 2 patients to talk about or something like that. And what is it that's calling you? Again, context matters as we think about, weighing, the values here and how we do it. So it's not like patients overwhelm everything. They don't. There are some things that happen but you have to make sure somebody else is caring for that patient if they're, acutely ill, and arrange for the handoff. I don't know if that answered your question, but it's part of being curious, asking questions, what's going on in your head? Why do you feel like you need to make that decision?
We've got time for one more question and one more brief answer. Dr. Leahy, you have the microphone.
That's funny. It's a great talk, and thank you for getting us to think about this. I was thinking about sort of an adjacent questions to Patty's about how best to promote professionalism within our field, knowing that unavoidably we are each imperfect, and we might have, different conceptions of what professionalism is. And in our public discourse, we're so accustomed to viewing difference or even errors as a contagion. oh, that student thinks that that was professional, therefore they're bad, or that professor did that, therefore they're bad. And it sort of truncates the conversation that necessarily has to happen, as you were describing it, of curiosity, or, oh, maybe Natalie and I have slightly different conceptions of professionalism, and that's fine. We're both good people. And how to promote that in the field, promote it to the
Yeah.
faculty as you're trying to do a change effort or effectively teach about it, whatever way, without running afoul of that knee jerk, you're dead to me now that you said X.
No, it's a great question. And I think we ought to be talking about it more in the positive. That's the problem. It only gets talked about when we think somebody has violated, ethics or professionalism in some way, as opposed to saying at the end of rounds, you know what, that was really great rounds today. And the interaction between you and the respiratory therapist or the pharma, that was really, the way you asked that question was incredibly respectful and showed the kind of professionalism that we're talking about. And I'm seeing winks going on. You guys may do that all the time here, because I think you're way ahead of most of us about it, but it doesn't happen at Harvard, I don't think, in terms of the daily operation, the way that we as faculty think about things, that we're going to bring it up in a positive way, not just somebody violated the code. Yeah.
There you go. So we're going to have to close. First of all, I want to thank Dr. Schwartzstein for sharing his wisdom, for joining us on this special event in our Professionalism Week. Thank you so much.
Thank you.
This Professionalism Week, these activities are an important opportunity for us to reaffirm our commitment to the tenets of integrity, accountability, compassion, altruism, social responsibility, cultural humility, kindness, and respect. We're really appreciative, Dr. Schwartzstein, that you could be here for this part of our week and be with us for this wonderful keynote address. This year's theme for Professionalism Week is altruism. And just as you were saying, making note, not as the negative part of unprofessional, but aspiration to be and to truly exemplify the principles of professionalism. We see it all around. And in some ways, we take it for granted when people are doing really a great job and working hard, even sometimes in difficult times. If you haven't seen these cards, they're around the given lobby. It takes 30 seconds for you to write down the name of someone and just say why you appreciate them for how they exemplify the core values of our college. Put it in the box. It will be distributed to the individual. I promise you, that'll make someone's week. And what's more, you will get just that little buzz of knowing that you did that for someone, that you acknowledged what someone is doing for each other, for our patients, for our colleagues, and for the rest of the world. So I encourage you, let's run out of cards. As we conclude today, again, I want to thank you for being here. The week continues on Friday at 2. Right here, we will celebrate, as Dr. Wilcox just mentioned, over 200 nominations. Now, we limit it to just 4 awards, 1 for each category: medical student, graduate student, staff, and faculty. We celebrate every one of those 200 people who have been identified by their peers as exemplifying the core values that are so close to us in our college. So afterwards, there will be a party. There will be a reception over at the Hale Gallery. So please come here, support each other during this week, celebrate the wonderful people we get to work with. And we'll close, but thank you so much for being here today.
Thank you. Yeah, appreciate it.